Medical Dilemma.
Welcome back to Medical Dilemma. Before we start our discussion for the second segment, I'd like to mention our major sponsors, St. Clair's Medical Center, Makati Medical Center, LifeQuest Training and Consultancy Corporation. Now, joining me for the second segment are my co-hosts, Attorney Sara Sugitan, Father Jerry Manlangit, and Dr. Tess Sanchez. Okay, of course, we still have our guest, Dr. BONG GLORIA.
Thank you.
Okay. Now, to open the discussion for the second segment, I think it's best that we first show that picture of the vascular system and ask Dr. Gloria to explain a bit, what the picture shows.
Well, the vascular system or the circulatory system is composed of two major systems, which is the artery and the vein. So the artery carries oxygenated blood basically. That the artery comes from the heart also, then it supplies oxygen to the target organs. Okay? And then once we utilize the oxygen, or the target organ uses the oxygen, it goes to the path where in the venous system, or the blue colored veins, it carries it back to the heart, to the lungs, to recirculate it.
So in the photo, just to make it clear, the red part represents the arteries,
which is oxygenated blood,
okay,
carries
and
oxygenated. Then the blue is the unoxygenated, which goes up, or which is goes to the lungs, to the heart, to be recirculated, oxygenated. Yeah.
Okay, so I guess that's clear now. Now, one thing that I would like to be clear about is the presence of wounds in the lower extremities. Okay. When you have wounds, does that mean you are already a diabetic?
Actually, yan po din ang medyo hindi magandang kasi hindi porket may sugat ka o paniniwala, tama po. Hindi porket may sugat ka, meron kang diabetes. Okay? Kalimitan nangyayari kasi sa atin, pagka meron tayong sugat, ang inaano natin is, naku, hindi gumagaling sugat mo. May diabetes ka na. Well, actually, maganda rin yun in a way. Kasi kahit papano, yun yung mag-trigger sa'yo para magtulak sa'yo na magpatingin sa doktor. At malaman mo kung may diabetes ka. So, yun po ang medyo pagkaka-misunderstanding doon.
Kasi very common din ang diabetes sa population natin.
Yes, ma'am.
Yes, ma'am. Kaya we're always very conscious about it.
Opo. Kaya maganda rin po. Maganda rin.
So if we have such wounds, which specialist do we go to?
Kadalasan naman kasi depende naman sa lugar natin eh. Especially, pero maganda rito sa ating sa syudad or sa Manila is this is a highly specialized area, so you can go to a surgeon, go to a dermatologist, go to an internist, okay, go to a vascular surgeon, okay. Marunong naman halos naman, well, lahat naman ng doktor marunong naman tumingin ng sugat eh. Then once they see the sugat, siyempre titingnan nila kung may diabetes ka o wala. Number one yan. Lalo na kung meron tayong medyo may edad tayo. And then kung sakali talagang medyo malala yung sugat, that's the time na magkakaroon ng referral system. Either sa surgeon, a vascular surgeon, an orthopedic surgeon, okay. Derma, kung pwede. So, doon naman po, pwede naman, marami naman pwedeng puntahan.
I see.
For example, you have this wound na, ano possible complications na mangyari kung pinabayaan ng tao ng sugat?
Siyempre, pag ay nasugat, ang problema mo dyan is infection eh. Kalimitan ng sugat, lalo na yung marami kasing klaseng sugat, ma'am. O maraming klaseng wounds. Okay.
Concentrate tayo sa legs.
Yes. Kung sa paa naman, unless, kunyari, hindi ka naman siguro nasagasan o nadapa o ano, kalimitan na nangyayari sa atin is yung mga kagat lang ng hayop. Or napinprick ka lang, nasugat ka lang na malit. And then, pagka napapabayaan yan at nanineglect, kalimitan, lumalala yan. Napapasok na infeksyon. Pagka hindi makontrol na infeksyon. And ang problema kasi sa setting natin, ma'am, pagka dumating sa atin, medyo malala na. Hindi sila, uy, malit lang to, kagat lang ng hayop. Okay lang, kaya mo na.
Mas ka ng hayop?
Kalimitan
Pwedeng-
kasi yung mga, ano dyan is yung mga mosquito, mga lamok.
Mosquitoes, yes. Oo.
Yung mga ganyan.
Okay.
So, dapat maging worry din tayo na pagka may sugat tayo, dapat medyo, lalo pag hindi gumagaling. Kaya nga, minsan, sabi ko nga kanina, mas maganda pa rin na pag hindi gumagaling, pa-check up kagad. Kasi
Lahat, oo.
doon mo nalaman kung ano talagang problema.
Attorney Sarah,
Bong,
yes.
yeah, you mentioned dun sa first segment natin that vasculitis is often found in people whose job requires them to stand long hours. Pero I read a study na sitting down for long hours is also harmful to your, I don't know if health or body posture, etc. So where do we draw the balance between standing up long hours and then sitting down for long hours?
Kung, attorney, kasi kung titingnan mo yung parehas na problema, okay, sitting down and standing up, basically, yung ginagawa niyan is, pagka nakaupo tayo ng matagal, bumabagal yung daloy ng dugo natin.
So may
Kaya nga,
effect pa rin.
kalimitan, kung nagta-travel tayo ng malayo,
Yeah, we have
usually,
to
di ba, may sa
stand
mga
up,
aeroplano,
di
may
ba?
nakikita tayo mga foot exercises.
Yes, exercises.
So, bakit kailangan nun? To stimulate the blood supply. Okay. So, ang kalaban mo naman sa pagkatayo, attorney, is yung gravity. Nakatayo ka eh. So, it will take, medyo mahihirapan yung pagdali ng dugo paakyat kasi kinakalaban niya yung gravity. So, nagkakaroon tayo na tinatawag ng stasis flow or pagbagal ng daloy. So, basically, halos parehas lang yun. Kung nakatayo ka or nakaupo ka. Kasi kung nakaupo ka naman at hindi mo rin ginagalaw yung paa mo, ganun
Masama
din siya.
din yun.
Bubagal
Oo,
din yung daloy.
yeah.
So, halos parehas lang po.
Pero ba't po yung parang namamaga yung ugat? Yung pag halimbawa, nung bata kasi ako sa school, pag syempre naglalaro, ganun, maghapon. Tapos pag-uwi sabihin nila, wag maghugas or wag magbasa ng paa. Kasi daw magkakaroon ng pasma. So kasi kapag daw po nagkapasma, mamamaga yung ugat. Tapos papawisan palagi. Totoo po ba yun? May mga ano ba yun? From a medical point of
I
view?
think
Or is
so.
this all,
Diba?
ano,
May ano
wala.
yun?
is this all,
May
parang old
basis ba
maid's
yun?
tale?
Wala po kasing attorney na medical term ng ma'am ng pasma eh. Wala naman eh. If you're going to, kung maghahanap po tayo ng katumbas na English word ng, kasi yung pasma is parang Filipino word yun eh. Diba? So, pero pag hahanapin mo yung Filipino word na pasma, wala namang word na medical word na pasma eh. Or na
It's
Oo,
not the same
so-
as minamanas. It's
No,
different.
manas is ano po, edema eh.
Inflammation na.
oo.
Edema eh.
So ito,
Hindi kasi parang ganun yung paniwala eh. Kapag matagal ka nakatayo or nakamedyas ha, Doc. Kasi di ba kapag grade school, you're in uniform. Pagkatanggal mo daw ng medyas, huwag ka daw magbabasa agad ng paa kasi mapapasma ka. May ganung maybe superstitious belief na
No,
apparently walang medical
pero may kilala
basis.
ko old wives' tales na sabi nila, but talagang ang ganda ng kanyang legs, walang kaugat-ugat, and that's what she really practices. Maski na yung nanganganak among the Chinese, they say, hindi ka dapat maligo ka agad because baka nga maano yun, yung maugat.
Pero it's interesting na there's no scientific term for pasma. No? Kasi it means that it's either hindi pa yun napag-aralan or maybe there is no equivalent. There is no, ano ba yan, parang hindi siya, di ba, hindi siya backed up by studies.
Wala.
So we learned something today, no?
Yes.
Filipino word na walang katumbas.
Meron pang isang sinabi si Doc kanina na interested ako. You said yung people who have to work standing long hours. Yeah, for example, mga cameramen natin. How do you prevent, for example, yung vasculitis? Do they need to wear compression socks all the time, Doc?
Naku,
Or
ayaw nila. Mainit.
mainit yung
Actually, tama, ma'am. Wala ho kasi, medyo mahirap talaga magsuot ng stockings.
Oh, masikip eh.
Kasi
no?
una-una
Pati.
mahirap isuot. Pangalawa, masikip. Pangalawa, sa environment kasi medyo mainit kasi sa atin, tropical. Kaya medyo mainit talaga siya isuot. So, pero kung hindi tayo magsusot ng stockings, ang isang pwede natin gawin pagdating sa bahay, i-elevate natin yung paa natin ng 15 minutes. Okay? And then, hindi pwedeng, kunyari, tako po tayo ngayon, dapat yan medyo ginagalaw-bulaw mo ng konti. Paano si-stimulate mo yung blood flow at
So-
hindi manatili o bumagal ang daloy.
So, doctor, is it true that when you do inversion exercises, it helps? You know, like when you wear anti-gravity boots, then you hang yourself upside down for a few minutes.
Well,
Does that really help?
Extreme ah.
pwede po kasi tutulungan niya yung daloy niyo pabalik sa puso eh.
Yes.
So, tutulong siya kahit papaano. Pero hindi not so long naman po. So, usually pagka ganun ang recommendation nga lang namin is pipit 2 pillows eh. Dalawang unan lang po.
Just 2 pillows is
To
enough.
elevate your leg, 15 minutes a day, then
That's
it's
enough.
okay.
more
It
than
doesn't have
enough.
to be a 90-degree angle pagtaas.
Yung compression stockings, I mean, do you have to wear it 24 hours a day? Hindi naman.
Mas maganda pagkagising mo sa umaga, suot mo na. Pagka-uwi mo, tanggalin mo, ligo ka na. Ganun lang po.
So that brings, yes, Father.
Well, let's go back to this particular disease, no? Well, because this particular disease can be, can be treated by, as you have said, by a vascular doctor, a dermatologist, or even a general surgeon, because they probably have the expertise of everything. There are times in which patients would like to go to other doctors, for example, no? And there is where, for example, sometimes the ethical issue would come in. There are doctors who seem to begrudge the fact that, Doktor, pwede ba akong makapunta sa ibang doktor para maipakita ko for second opinion or something like
family
that?
med, no?
Family med or
ganyan,
something like that, this referral system, no? How do you take this, no? Because, well, as you have said, pwedeng dermatologist, pwedeng general surgeon, pwedeng ikaw, vascular expert.
Maybe
for
sa
that
una
matter.
lang, initially, di ba?
And sometimes the patients,
nung huli.
well, I'm not satisfied.
Well, actually, Father, pagka ganung mga pagkakataon kasi, ako personally po, nakaranas na ako dyan na
Oo.
ang isang pasyente o isang tao may sugat is galing sa ibang doktor.
Oo.
Iba-iba na.
That's right. No? Iba-iba ng
na. Kaya
pinuntahan.
lang pupunta sa Dok, di ako gumagaling sa kanya eh.
Right.
Di ako gumagaling, ba't ganun? So, parang kumbaga, ako naman ho titingin. And for me, sometimes kasi po, no, yung sugat kasi, anybody can manage naman sugat.
Right.
Kahit nga walang doktor, kahit mismo yung pasyente po eh, di ba? Kaya lang gamutin yung sarili nila. Pero, ang ano dyan kasi, minsan, maganda na makita ng tamang doktor para ma-evaluate ng maayos, ma-examine ng maayos.
And there is where sometimes the dilemma would come in because, well, if a patient would go to the doctor, he wants to treat it. Whether or not he has the expertise, kaya ko naman ito, or something like that. Now, nung hindi gumagaling, he would go to another doctor, for that matter. So, sometimes, well, parang, kadilema na tuloy yung, sino ba talagang pupuntahan ko? Precisely because, well, as you've said, you go from one doctor to another, something like that. The patient trust is also compromised. Patient right may also be compromised. And it's always the patient who should make the decision for that matter.
I think,
So,
I don't know, Father, I think it's a matter of transparency. I think the doctor should tell the patient, hanggang dito lang alam ko. I remember I'm an orthopedic or I'm just a family med. Let's try to treat it. Pag hindi kaya, refer kita sa iba. What do you think, Father? What do you think?
Tingin ko, Father, ano dyan kasi, ang malaking factor dyan kasi yung proximity. Proximity,
yes.
tsaka availability ng doktor po.
Yes, oo.
Yan tingin ko yung isang malaking bagay.
I think so, yeah.
And
I agree.
marami kasi sa atin, especially sa mga far-flung areas, tulad ng mga probinsya, and mga liblib na lugar, wala silang available na yung talagang specialist.
Okay.
So, ang mangyari po dyan, Father, is pupunta sila diretso kung sinong available na doktor.
Right. And the doctor who probably may not have the expertise, something like that, would also like to treat it. And probably not because of any malice or anything, but because he wants to help.
Opo.
Okay? He wants to help. Any doctor would like to help, no?
At saka pag hindi naman mukhang malala na, kunwari nakikita mo na yung buto doon, siyempre siguro first aid na lang, di
Right,
ba?
right. So probably it's all still education that will probably give answer to this, no? The patient must be educated as to whom or who the doctor should should ask. Because sometimes the doctor will always, okay, let's treat it.
I remember, Father, I remember one case sa ER. Talagang yung bata, may dala siyang anak niya, no? Pero naghanap talaga ng specialist. Sabi niya, I do not want any pediatrician lang. Kailangan, pulmonary pediatrician kasi meron siyang asthma. Di syempre, mas mahal ang charge, di ba? So how is it? Is it that way also in your profession, Doc?
Ako, personally, ma'am,
Siyempre.
hindi. Ako
Hindi.
safe.
The same. I see. As the rest.
Attorney, I have a question. Because it seems that vasculitis is caused by certain occupations. So, can we consider vasculitis as an occupational hazard?
Oh, yes, definitely. It's sabi nga ni Doc, yung may indication that it can be work-related or it's caused by a certain work environment. Ngayon, ano yung duties doon, for example, ng
The
employer or
employer,
ng
yes,
establishment?
that's the question I have in
Oo,
mind.
Kasi ang problema ngayon, Sunny, most of the employees, for example, sales ladies, are employed by agencies. They're not
Right,
directly
right.
employed by work,
Not
their
by
place
the-
of work. For
yes,
example, not
yes.
in the mall where they work.
Yes.
So, the one who should provide the tools or whatever is necessary to address this occupational hazard should be the principal. So yung
Right.
agency.
That's correct.
It's not
That's
the
correct.
mall itself or the establishment where the sales ladies are working, for example. So it's you may say even to the extreme, it may be an unjust scenario because the one who should contribute to that is, for example, the place of work where these people are working. However, in reality or in the legal relationships are such that the burden falls on the agency
The
rather
agent,
than
yes. Not
the place of work.
Right.
Yes, of the may tawag sa kanila contractuals.
So,
yun.
in which case, if a patient, let's say, is suffering or is detected to have vasculitis, can he or she sort of go back to the
Claim.
agency employer and ask for
I think they're covered by
recompense or
I think mahirap
or
yan because
assistance?
you don't know when the vasculitis
It is-
or
yes.
that problem started, di ba?
It has
Di
to be
ba,
work-related.
Doctor, may I pass the back to you? I mean, di ba normally as we age, we tend to develop these problems like
Yes.
varicosities, etc. So how can you just pinpoint that it's due to his work or her work? Di ba? What do you think?
it has to be clearly delineated, Doctora. Like for example, in the case of
That's an hazard.
Yes,
occupational hazard. But
occupational
you won't,
hazard, yeah.
you need not do
There has to be a
anything
hazard
there.
pay.
Just
Oh,
for the veins, vanity naman yun, Father.
More than
already.
more than the salaries and wages, something more because there has to be hazard pay.
So initially,
covered
they have
by-
to check first the legs. Do you have varicosities? Oh, no,
so they
no.
undergo a general PE, I believe, but they're only covered by a very minimum or very basic coverage.
Siguro
like
kung
fit
grabe
health.
yung mga ugat.
Yes, so,
Hindi
pero
mo
kung
na-hire.
hindi na siya
Hindi
o
mo
may
na-
employ, yes, so no longer fit
Kawawa
to work,
naman.
siguro kung gano'n. Pero for example, in other diseases, for example, in the case of seafarers, if the injury or the disease is is directly linked to or caused by the kind of work that they had to perform, then they can claim for compensation. Pero sabi nga ni doktora, hindi wala tayong case na nag-claim ng compensation for
Vasculitis.
vasculitis. So
Yes.
Actually, ma'am, pag kalimitan ng mga yung mga ginagamot namin dyan, especially yung mga magtatrabaho, mag-a-apply na, is kung meron ng mga malalaki ugat na kung may vasculitis, may varicose veins. And tama po, Atty. No, meron kaming mga nakikita ho doon na yung hindi sila makakaalis unless i-treat yun or unless may clearance sa amin. So, kapag nag-pre-employment physical examination at mayroon silang nakita ng problema sa ugat,
Kasi, oo.
kadilitan humingi sila ng clearance sa ampat ng doktor para doon.
Kasi ano sila, long hours,
Yes,
long weeks out. no?
And
Sa sea.
marami po kami ma'am na ginagamot o inooperahan. Karamitan mga seaman o nag-abroad o nag-apply ng trabaho. Kasi
Okay,
pag may
doctor.
nakita sila.
Yeah. Okay, doctor, we'll have to pause for another commercial break. We'll be right back after a few words from our sponsors. Thank you.
Many of our products were designed to be used in industrial and medical economy.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Like, there are other senses of it. So you hear it, you see it, and then you can smell the fireworks.
Now, would it be okay by asking you're already practicing?
You need a word here against you.
Something that I've learned is
Words can inspire and words can be strong. Choose yours. Okay?